very much. Right, this is what we are sharing. The title still remains The Bandit Trap, Why We Are Sicker and Dying of Errors. Just at the peripheral level, I'll still go deeper in some other things, perhaps not necessarily controversial. When we take a deep dive into some of the things we should be eating, and then we look at like red meat. You have been told not to eat red meat. I don't think I'll get there today, but if I'm able to do that, after settling this one now, and then if I'm able to do that, we're going to that why you have been not, you've been asked not to eat red meat. This is what we did last week, where we looked at trends in diseases. I will only talk about just one. Look at the 1930s, you see prevalence. Prevalence means the total number of cases. If you say prevalence of diabetes in Nigeria, how many people in Nigeria have diabetes? And then I put it in percentage form. That is every 100. Is it 1%? Is it 2? Is it 3? So you look at the 1930s, every 100, it wasn't even up to 1%. Maybe every 400 or 500, you have 1%. Then in the 1980s, you see, in fact, it wasn't even every 400 or 500 in the 1930s. If we go back there, you see, it was actually insignificant, maybe every 1,000. But then in the 1980s, you see that it's about 1%. Nigeria is the green. If you look at this graph, United Kingdom is the first one, the second one is UK, and the third one is Nigeria. So, and then you see now currently it's about 3%. I still argue this 3%, and I'm going to show you why. Look at this point in Nigeria. Year 2000, 206,000 people had diabetes. Year 2024, 3 million after 24 years. That's 1,400% growth. I don't know if it's incredible, as in if the right word to use is incredible or another thing. So, like I said, it's only just one I'll share. The question is, even some things that were non-existent before. Look at this one, autism. In the 1930s, there's one I skipped before, non-existent. Now, it's prevalent, it's everywhere. The question is why we're getting sicker. The advancement in healthcare, we all can testify to that. And I will have to give credit to healthcare in one area. That area is acute care. Because if maybe 250 years ago, I didn't show some graphs, maybe in the future we'll show that what happened like 250 years ago. The people were dying of infectious diseases. You have pneumonia, you die because there were no antibiotics and all that. And then towards 1900, you have not WHO, the association, International Health Organization that metamorphosed into WHO was formed. And they started bringing in some changes in terms of sanitary measures like indoor plumbing system, a couple of other things were introduced. And because of that, the rate of acute diseases, that's what these infectious diseases like plummeted, just crashed down. And then you can see a lot of advances. But despite that, there's still astronomical rise in chronic diseases. So it looks contradictory. Why where healthcare is advancing, the chronic diseases are progressing. So that's what we're looking at. And we're now looking at the fact that handling chronic disease right now, this diabetes, high blood pressure, cancer, arthritis, ulcer, they're not curable. None of them is curable. In Nigeria, apart from malaria and infection, nothing is curable. Don't know how many of you will like go to me? You go to hospital and you have, is it curable? They will tell you, you manage them. So the question is, why is this so? Whatever we're giving is suppressing symptoms. You have high blood sugar, you take metformin and whatever, it will crash, it tomorrow, it will rise again. Take again, it will crash tomorrow, next tomorrow, it will rise again. That is it. So it's like bandit approach. That's what we're doing. So we're looking at some of the causes. And that's what we discussed last week. Dark forces and the politics in healthcare. The politics in healthcare was actually what we discussed last week, and the diagnostic and the treatment models. I will share that one again maybe in the next 1 or 2 weeks. And then the fact that no preventative measure. There's nothing that prevents anything. Nobody can give you anything that tells you prevent stroke. But you're taking antidiabetic, many of them still have stroke, still have an attack. And then we looked at the influence of the dark forces, and then we talked about these dark forces. And these are for the benefit of those who were not here and those that wanted me, not plenty of them, people that wanted me to recount. Government agencies, big pharma, scientists, medical societies, and big food industries. So you want to know big pharma, just go to any pharmacy store. You see 90% of the products there, they are not made in Nigeria, made by big pharma. Government agencies, equivalent is NAFDAC in Nigeria, but we're not talking about NAFDAC, we're talking about like others in, outside the country, like FDA in America. We have the medical associations, we have the big food. Just go to your supermarket or grocery store, whichever one you like to go. And then we said one of this create the disease and the other one perpetuate it. And then we now used one example, which is cholesterol. We have been told cholesterol causes heart disease, saturated fat. Don't eat eggs, don't eat red meat, don't eat butter, don't eat all these things. Animals, you are eating red meat, cholesterol, heart disease. The question we answered was, do cholesterol actually cause heart disease? And my own answer is unequivocally no. It's a lie. We've been told this lie. And I gave you an example that if it causes heart disease, it means this guy here caused that thing. And then I started proving it to you that for anything to cause another thing, like A to cause B, A is both necessary and sufficient. So A must be there. 2, A alone is enough to cause it. So if we apply this concept, this is scientific, we are proving it with research. If we apply it, discover that the past 55 years we'll be eating low cholesterol. We've been told to eat low fat. And then 1987, when lovastatin was introduced, cholesterol reducing medication, they call them statins. That's the group they were introduced. Despite that, look at this. 1980, the current heart disease, it didn't come down, it still went up. Because it was around that 1980, these things were introduced. So heart disease would have gone down if cholesterol was the cause. Okay? And then look at this other one. This from Lancet. Look at 1990s, in the 1990s, the one highlighted, heart disease, #1 killer. 2019, heart disease, #1 killer. Even the year of COVID, this 2021 report, 2020 event, you see heart disease is also the #1 killer. And then I mentioned a study that was done in the US in 541 different hospitals. Within a couple of years, they looked at the people that were admitted for heart attack, and then they checked their lipid profile. That's cholesterol. Let's use the word cholesterol now to, explain that. And they discovered that 75% of them that had heart attack had low cholesterol. Does it make sense? What I'm giving you all this is for you to know some of this. So we now took a journey backwards into history to look at how this happened in the 1940s, how heart disease became a public health emergency. And then all studies were now like there. All researchers were going there, along that line. Okay, then you now have one cardiologist, Dr. John Goffman. He was the first to say, when you eat cholesterol or saturated fat in your food, like egg and red meat, it's going to elevate the blood level of cholesterol, and then it will cause heart disease. He's the first to mention it. And I mentioned the fact, this is the study. I mentioned the fact that after a couple of years, he wrote this book because he discovered that people that come to him for heart disease, the way he's treating them is to reduce their carbohydrate consumption. So he now said, it's not really cholesterol. Like in today's determination now, we say LDL cholesterol like it is, it's not this LDL cholesterol. It's actually a part of that. If you do lipid profile, you have LDL, you have HDL, you have total cholesterol. You also have triglycerides. Discovered that it was actually that triglyceride. And that triglyceride is fat actually, but that fat is not the fat you consume. It's not the fat that you have eaten. It's the fat that is made in your liver. because of excess carbohydrate or when you eat sugar. Because a lot of times you eat sugar, the glucose can be used by the body, except it becomes excess. It will now be converted to fat. But fructose, which is part of the sugar, is not used by any cell in the body. What happens is now it enters the process called de novo lipogenesis in the liver and is converted to fat. So the same thing was also discovered by another consultant cardiologist. So, but nobody listened to them because of this man, Ansel Keys. He saw WHO study, that's World Health Organization. They studied different countries, looked at how much cholesterol, saturated fat they eat, and how heart disease is in that country. And he plotted this graph. If you look at this graph, it looked like it was very okay. Japan had low cholesterol, so they have less heart disease than Italy, than England, Canada, Australia. Then the US had the most, and they had highest heart disease. But there was something they didn't know, that he actually manipulated the data. Because WHO, if you look at the far right, WHO studied 82 countries. He only selected 6 countries that lined up with that hypothesis, and he plotted that graph. And criticisms came because from that Japan, if you go down, for example, France eats a lot of saturated fat. Meanwhile, they have disease is not even as much as that Japan. They eat more than US. So you can plot that graph downwards again. So, but nobody listened to the criticism because he just got a grant, $200,000 every year to study 7 countries. These are the 7 countries for 20 years. And this is the publication he came out with. And then suddenly, in 1961, American Heart Association just made a recommendation. Because then people that were cooking, they would use ghee and some other things that are made from animal fat. So those ones are full of saturated fat. Also, coconut oil, tropical oils, coconut oil, and palm oil. These have high level of saturated fat. They now say instead of using those things, start using vegetable oil. Vegetable oil are part of polyunsaturated fat. And if you look at this study, the publication, you see that Ansel Keys is part of the people. And how did this start? I'll give you a story how Crisco was made in 1911. Crisco is made from cottonseed oil. I don't want to go over to 1860 how it all started. It will take our time. But when it was introduced, Procter & Gamble, the marketing was like very, very serious to make it overtake the other ones like palm oil and coconut oil, and then started using health professionals to do the marketing. Then margarine was now introduced. So margarine is from trans fat. And then in 1948, they did a program, they realized a lot of money, and then they said they wanted to launch American Heart Association. They gave them $1.74 million. That's what many people believed that necessitated that advice in 1961. It would be like a payback, to them, because there was no study that proved it. And there was no internet that time. It's only studies, and then the news will carry gradually. You can see how the surge in the consumption of vegetable oil happened in the US after that. And this is the Ansel Keys, man behind all this. This is Time magazine in 1961, where he was lauded for, what a discovery. But then, thank God for independent researchers. Independent researchers, went into work and began to look at different things and say, how cholesterol, saturated fat, it has not been proved. Let's, proven. Let's look at other things. And then in 1965, they discovered that there was an elephant in the room. The elephant in the room is actually the same elephant in the spoon, which is sugar. And 4 studies were published in one particular month in 1965. These 4 studies, those are the ones I circled, I'm just showing all this if anybody want to make reference to them. And you know what happened? The vice president of Sugar Association, they call it Sugar Research Foundation that time. His name is, or was, John Hickson. He took those 4 papers I showed you. He now went to Harvard University and met three professors. One was Frester, head of Department of Public Health, and then Mark Hexted was deputy, and then another guy called Robert Magandy. Gave them bribe $6,500 to write an editorial in New England Journal of Medicine to exonerate sugar as the cause of heart disease, because those papers they already pointed accusing fingers on sugar. Now he wants sugar to be exonerated so that the talk will still be on cholesterol and saturated fat. And they collected the money and they wrote the article. This is the article they wrote in 1967. You can look at their names there. They wrote this article. And you know, this article now changed the trajectory of conversation. And it was quite painful. And you might be asking, I know, how did we know? Many years after then, one of the sugar industries also collapsed completely, went bankrupt. They gave their documents to University of California, San Francisco. And many years after that, almost 55 years, so researchers now started digging into the internal conversation. That's how they discovered all this. You look at New York Times publication on that. I'll just read a little for the benefit of those who were not here last week. September 12, 2016, it said the sugar industry paid scientists in the 1960s to play down the link between sugar and heart disease and promote saturated fat as the culprit. It's a newly released historical document. It's the internal sugar industry document recently discovered by a researcher at the University of California, San Francisco, and published Monday in JAMA Internal Medicine. That is the journal I just showed you in the previous page. It says, suggests that 5 decades of research into the role of nutrition and heart disease, including many of today's dietary recommendations, may have been largely shaped by the sugar industry. So most of the dietary recommendations you're having today have been shaped by the sugar industry. You can see the second line. It said the document showed that a trade group called the Sugar Research Foundation, known today as Sugar Association, paid 3 Harvard scientists the equivalent of $50,000 in today's dollar to publish in 1967, which I showed you already, review of research on sugar, fat, and heart disease. So that's what they did. And it was quite unfortunate. But then, American Heart Association has already said, instead of taking cholesterol, saturated fat, eat polyunsaturated fat, which is vegetable oil. I'm just using these words so that we will understand it very well. So they now did some studies. The first one, Sydney Diet Heart Study, where 458 Sydney men between 30 to 59 years with heart attack were used. So one group was assigned to, okay, eat normal, your cholesterol saturated fat, okay? Then the other group, don't eat this cholesterol saturated, eat them very, very little and eat more of polyunsaturated fat, which is vegetable oil. And look at the result. What happened? They hit the result because it was against what they thought was going to be the outcome. They hit it after many years, like is it 40 or 40 plus years? Because it was government sponsored, people were just clearing the basement and they now saw. They said, they looked at the web and everything. They said, these results were not published. They now had to call one Christopher Ransdell, who is a clinical investigator, smart guy. And they now looked at it. This is the publication. And this is why they didn't publish it. On 3 levels, whether you are looking at people dying from all causes, or people dying from cardiovascular diseases, or people dying from coronary artery, that's when the blood vessel that supply the heart is clogged. You see, the risk of dying is higher for people that are eating vegetable oil. That's why they didn't publish it. And then this is another study, almost at the same time, but this one went for 5 years, between 1968 and 1973. And they used over 9,000 men. And these men and women were in mental institutions, so they were able to control what they were eating. The same thing, half was assigned to reduce saturated fat, cholesterol, and all that. The other half, eat whatever, saturated fat, eat the normal way to eat. And you know what happened? They finished the result, look at it, they finished the study in 1973, got it up there. And then look at down, when they published it, 1989. They waited 16 years. Why? Because it was still against what they were expecting. It didn't go that way. So when the other one I showed you that was discovered after many years, the guy, that Christopher Ramsden, who's the main clinical investigator, now called the son of one of these investigators, the main investigator actually, and now called him and said, look at your father's basement, look everywhere and see if you will find anything. And he found. And then they now looked at it again. They discovered that most important data were not published. Look at the New York Times report on it. I don't have time to read it, but let me show you 2 lines. This highlighted in red in both up, paragraph up and the one down. Look at it. Say, among both groups combined, that's all the groups, both old and new. Sorry, old and young, old people and young, you see, a 30 milligram per deciliter decrease in serum cholesterol was associated with 22% higher risk of death from any cause. So, because these vegetable oils, one of the things they do is that they lower cholesterol. So if you eat a lot of vegetable oil, your cholesterol might not be high. It might be low, but you're killing yourself gradually. So they discover, this is what they discovered, that, as this cholesterol is dropping, the risk of dying for all the groups is 22%. But look at the other red line on the down paragraph. It's among participants who were older than 65 years at baseline, as when they started, they were older than 65 years. A 30 milligram deciliter decrease in serum cholesterol was associated with 35% higher risk of death. So for older people, the lower the cholesterol, the higher the risk of death. These are published to, these are reputable journals, the biggest journals you can find. This British Medical Journal, they rebranded it as Medical Journal than BMJ. So these are the things that have been clear, but politics will not let us look at. So when we look at studies, one of the challenges in nutrition sciences, a lot of times you hear conflicting things, conflicting information. And why do you hear those conflicting information? Because a lot of people have been paid, to report certain things which are not true. And that is why you see conflicting information in healthcare. Secondly, some people don't know how to do research. They just go and read the summary. I have seen many studies. Maybe in the future, I don't have time now for that because I have a lot of things to share. And once a week is even too slow for me to share some of the things I know. In the future, maybe when I've shared quite a lot and many of you are loaded, I'll now share some studies. Maybe I'll tell you how to, you might not be in science, but I'll show you how to interpret 1 or 2 things. And I will show you some studies where they lied in the interpretation and the result. There's a particular study on this cholesterol and the use of cholesterol reducing medicine, for example. Meta-analysis or systematic review is when you look at, they do each studies, let's say they do a randomized control trial, that's the highest quality evidence we have. They do 10, they do 12, they do 20, they do 15, You now collate all of them and then analyze them together. That makes it stronger. That makes the evidence stronger. And do you know what happened in one of them? A group led by one Professor Robert Collins, Oxford University. You can just Google him, you see his name. And then they quoted 11 or 12 studies, and they misquoted 9 of them. Look at some of this study now. So the effect of replacing saturated fat with mostly polyunsaturated fat, which is like, let me say, replacing olive oil or coconut oil or palm oil with vegetable oil. They say the effect, a meta-analysis. So they looked at different studies. But what they said? They say when pulling results from the adequately controlled trials, that's down the result. Down, down, down. They said there was no effect of major cardiovascular heart disease. So we have been told all these things and we believe them. And do you know what happened? One of those 3 professors that was bribed in Harvard was not promoted. He became the head of USDA, United States Department for Agriculture, the head of nutrition there. And do you know what happened in 1977? He was the one that wrote or compiled the first ever dietary guideline. So imagine somebody who has collected bribe for, saying whatever, and then he lied to us. He's now giving us dietary guidelines. And I put America and Nigeria side by side because sometimes you'll be wondering, why are you sharing all this? We copied them. It's exactly the same thing. So it's what they are asked to eat there that we ask our people to eat here. And all those lies were now promoted. The low fat lie by the media, by physicians, by the government, everywhere. Low fat, eat low fat, eat low fat. That's why from that time, every time you go to the grocery store, to the supermarket, most of the food you say either no cholesterol or low cholesterol, no fat or low fat. And you're eating them, you're happy, you think you're eating right, not knowing that you're eating poison. And do you know what happened after then? Obesity increased. You can see, that's why I started with, sorry, today I didn't show you all those increase. I showed 1930s, 1980s, and then currently. I showed a lot of diseases, heart disease. I showed cancer, I showed diabetes, I showed high blood pressure. I showed all of them increased massively. Meanwhile, we thought we were doing the right thing. So all these are studies that support what I'm saying: dietary cholesterol and lack of evidence in cardiovascular disease. So these ones are showing that there's no evidence that this cholesterol causes heart disease. Look at this other one, say fact or fiction, the diet heart hypothesis. And if you look on the right hand side, say meta-analysis, we identified 17 meta-analysis that broadly. So these ones are not looking at even individual study, they're looking at meta-analysis. That's a meta-analysis can have 20, 50, 100 studies. They now look at this. So these people looked at almost everything. If you look at the last third line down, they say to summarize the result of this meta-analysis do not support the diet heart hypothesis or the recommendation to replace saturated fat with polyunsaturated. I hope we are getting it. So that's why I brought all this. And the question, I think that's how we ended last week. If cholesterol doesn't cause heart disease, that's clear. The people really need to take cholesterol lowering medicine. These statin products, statins are cholesterol reducing products. It's actually a big empire. Like I mentioned before, the first one, lovastatin, was introduced in 1987. Right now, over 200 million people use statin worldwide. So it's $1 trillion, not 1 year, but over the years. Most of us know Lipitor is the most prescribed prescription medicine worldwide and is the most profitable ever. There has been hot debate in the US. In fact, there's one reckless physician in the UK that said you can, just put it in drinking water. Can you imagine that? Everybody would have been dying. I didn't bring some side effects here. Statin side effects. So most men are having erectile dysfunction. It causes insulin resistance and then diabetes. If you use it 5+ years, you're lucky not to have diabetes. If you use it for a long time, you're lucky not to have cancer. These are the things that happen. So when you use a lot of this and you are dropping your LDL, this LDL we are dropping is part of the immune system. So you see a lot of people dying from different causes. I said, did you know the target level for cholesterol and LDL is a moving target? So between 1987, that lovastatin, that first one was introduced, and 2016, there's been 600% increase in patients on statin. Do you know what that means? It means before, normal cholesterol was 300. After a while, 270. After a while, 250. After a while, 220. After a while, now it's 200. So they tell you the less is better, but that is not true. The less is better. So it means if yours was 300 before, you don't need to take the cholesterol reducing medicine. Now, if yours is 300, it will be like it's too high. You have to take it. Look at the second one. In 2000 and 2004, US National Cholesterol Education Program revised the definition of high cholesterol. It's part of what I just mentioned in the first one. It showed that 8 out of 9 of the panel member, that the people that revised this, so they will call some people together. So, okay, you are at this panel, look at the cholesterol. Should we reduce it? Should we, for health and all that? 8 out of 9 of them have ties with manufacturers. So imagine somebody that is paid by the manufacturer of the product that lowers cholesterol. They now put you in a group, in a panel, to say, okay, how do we, this cholesterol thing, do we lower the range? Do we increase it for health? What do? So you want it to go lower so that the company will sell more and you get your commission. Well, that's basically what it's saying. And these other ones, let me know. Okay, look at the last line there. It said, not the last line in the box. It's a veil of secrecy surrounding the data on this industry-sponsored trial. I think I mentioned a little bit of it last week. That when somebody does, or any group or whatever, you do any research on any product, ampiclox, paracetamol, whatever, you bring out the data so that other people can see. Independent researchers will now see the raw data, I mean, where you collected all those. But for this one, they hid them. Nobody saw them. And look at what someone said, Professor Gosche, who is the founder of Cochrane Collaboration. He said, when drug industry-sponsored trial cannot be examined or questioned by independent researchers, science ceases to exist and it becomes nothing more than marketing. So that's basically what it is in terms of, marketing. I'll read this one. The original stating data are hidden. How do we know what they say is true? That, like I said, the original data, all we are seeing is the data they told us exists. Do we know if it's true? And then the second one is like an interpretation of that. So when independent scientists' analysis of the raw data, we can't be sure of the information the pharmaceutical companies gave us. It's a typical examples are Tamiflu from Roche. There's a flu product from Roche that the UK government bought. In fact, they spent 500 million pounds to stock for flu. And then this Roche now gave independent researchers their raw data. And when the independent researchers looked at it, they saw that it was not more effective than paracetamol. And not just that, it has a very serious harmful side effect. And because of that, the UK government wasted 500 million pounds stocking it. I said, and COVID vaccine, which were analyzed in different results. The COVID vaccine also, yeah. When these people that brought the vaccine told us it's 95% effective and all that, and then independent researchers reanalyzed them, it was not effective. I don't have time to tell you all the data about them, but they were not effective. They caused more harm than good. For people that are young, people that are really, really young, it will take like 100,000 for you to get infection of COVID and be hospitalized or have risk of death. So 1 in 100,000 of them. For those that are older, like 60, 65 and above, it will take about 1 in 3,000. Okay? Meanwhile, the vaccine is causing harm in 1 in 800 people. So can you reconcile that? 800 people will take vaccine, 1 will be harmed. Meanwhile, 65 years and older people infected by what you're trying to prevent with the vaccine, about 3,000 of them, 1 in 3,000. So which one is more effective? So it's better you don't treat it than treating it. And then there's a study, a cohort study, Framingham study that shows that even the LDL cholesterol we're trying to reduce, we say limit is 150 down. That can only be harmful when, of course, there's nothing that is, you say no matter the range is not harmful, no. But it can only be harmful when it's over 300 milligrams per deciliter. And these people are being careful, let me put it that way, because there's a study I saw that is less than 2 months. There's even studies recently done by hyper responders who LDL can get as much as 560 milligrams per deciliter, showed no progression of atherosclerosis, that's heart disease or clogging of the arteries and all that. Imagine as high as 560. Meanwhile, the benchmark is 150. If it's more than that, they'll put you on cholesterol. This is a medicine. And you know the reason for all this. It's money, money, money. Let me show you this particular one. This from a study, BMG2. I only cite peer-reviewed articles and then from reputable journals. I don't cite any other journals. You look at different lines. You have Australia, you have Europe, you have UK, you have Japan, you have US, you have Canada. These are different Food and Drug Regulatory Agencies, just like we have our own NAFDAC. Look at that first line. You have proportion of the budget derived from industry. For Australia, 96% of their budget is from pharmaceutical companies. 96%. For Europe, it's 9%. Look at all of them. So you having 96% of your budget sponsored by a pharmaceutical company, what will you say? Who is regular? That's the title of the article. Let me show you the article. This is the article. You see, from FDA to MHRA is the one in Europe. You see, are drugs regulators for hire? As I say, so are we hiring drug regulators now? So maybe pharmaceutical companies are hiring them. So what does that mean? They only bid, they do the bidding of the people that employ them. And then people will always ask me, how do I use that things? If you ask me, this is my answer. If you know the toilet, just pour it down there. Sorry, what did you say? My question is, what did you hear? All right, let me explain this further. When should I get worried? Like, does it mean I send people to do cholesterol panel? Yes, a lot. As a matter of fact, most people, 99% of people that come to me, I ask them to do total cholesterol. There are people, in fact, I have 120, I have not only one, many of them 21, 22. And the total cholesterol is 220. And then the next thing is they are put on cholesterol lowering medicine. So when they come to me, I will say, sorry, if you know your toilet, if it's not too far, throw it away. And many of them, there might be one or two on this call. It's just that I usually don't like, if one of them had told me, anyway you want to, because of some result, I will share a story later. You can call me, let me come and testify. But I usually don't do that. So I just want people to believe me for the science itself. You know, total cholesterol is meaningless, except on one condition. Somebody has what they call familial hypercholesterolemia. That's genetic, you know, and the cholesterol will be reading like 600, 700, 800. And you know, those people die. They might die more, faster than the general population. But they don't die because of that cholesterol. They die because their clotting factors have problems. That's why they die. What about LDL? LDL is the main thing now, the king. If your LDL is high, well, now you must take that cholesterol reducing medicine, because what it lowers actually is LDL. As it's lowering it, the total will be going down. And they tell you lower is better. Some people come to me, their LDL is less than 100, and their physician or doctor will clap for them. I will tell them, I'm sorry, I won't clap for you. You are in danger. If it's less than 100, you are prone to cancer. You can have cancer. You have all kinds of infection. Every time you'll be sick. And then HDL. Yes, the higher the better for HDL. That's right. HDL is, it has a lot of, maybe another time I'll come and explain what each of them does. But LDL is important. Let me go back to LDL. We have demonized LDL. For the purpose of maybe scientific people that are here, some pharmacists, I've seen them join. There might be doctors, there might be other people that are lab scientists that are here. LDL is not only one. LDL is two. There's a small dense LDL. There is large buoyant LDL. I'll go into that later. Unscientific people might not really understand that. Then let's go to triglyceride. This is the main thing I look out for when I send people to do this test. The triglycerides. That is what is important. And what is important in this is triglycerides versus the HDL. So whenever you see this result, for everyone listening, the most important thing is triglyceride HDL ratio. So divide this triglyceride by HDL. If it's less than 1.5, you are safe. Some studies will say 2. But if it's more than that, you are not safe. If it's more than that, let me give you an example. I have 2 clients. I didn't give you the exact thing for this client. I removed 1 or 2 things so that even if they are watching, they won't know they are the ones. One is in Nigeria, another one is in US. The one in US is even into healthcare. I have a lot of them like that. Look at for the one in Nigeria on the left. Total cholesterol is 223. In the hospital, of course, they will write you, they'll bring out the pad and write you cholesterol reducing medicine. LDL, once it's above 150, they will write it for you. They'll tell you are not sick. But look at triglyceride HDL ratio. What is it? 1.34. Okay? That person is very sick. And then look at the one on my right-hand side. Cholesterol is 165. They will clap for you. They will tell you, wow, LDL is 93. In fact, the bigger clap, they will give you bigger clap. You know, look at the ratio, triglyceride LDL, 3.37. This person can have stroke. This person can have heart attack. Unfortunately, our practice today is like 50 years behind science. And these are proven by, I'm not that smart to bring this thing from my head. It's science. Because it has been shown that triglyceride stroke HDL ratio is the surrogate marker for one thing they call insulin resistance. And that insulin resistance is a big problem that most people don't take, cognizance of, or they take for granted. And that's what happened to this young lady I'm talking about, around middle age, middle 20s, right? Like 24, 25, last year, was already having heart symptoms. Shortness of breath, was having arrhythmias, legs were swollen. When your legs having, they call it edema, the legs are swollen. It means the heart is not functioning properly. It's not able to pump blood and all that. And then a couple of other things, skin tag around the neck and all that. And she went to hospital 1, hospital 2, hospital 3. Her cholesterol was a little bit elevated to 20, and that's all they were giving her. Cholesterol medicine, cholesterol, and she was not getting better. Send me the result. I did the calculation. The insulin resistance was about 3.8. That's triglyceride HDL ratio. And after that, the problem, insulin resistance. Because when you're resistant to insulin, it's associated with a lot of diseases. Heart disease, cancer, diabetes, arthritis, name everything. Insulin resistance associated with them. And that was what I did. I gave her 4 supplements, and then I gave her dietary changes. You know what happened? Within 4 months, all those symptoms disappeared, 100%. Today, she's happy. Look at this study. We looked at 19, I think I showed you last time, 19 studies. But as an altogether, there are 30 different studies they looked at. Over 68,000 people. Look at the conclusion. High LDL cholesterol is inversely associated with mortality in most people over 60. The other ones it's not as if it's the other way around. No. For some, there was no difference. They lowered the cholesterol, and the other ones that had higher, no difference. But for majority of them, the lower the risk of dying is increased. Look at this other study. Say low cholesterol is associated with mortality from stroke, heart disease, and cancer. What I'm saying is science has advanced, but medical care has not. Why? Look at 1961, the one on the left-hand side. That's what I showed you before. Look at the one on the right-hand side. Look down. This Time magazine. They say Time magazine cover story 2014. Scientists were wrong about saturated fat. They don't cause heart disease after all. So it means we have been fighting the wrong enemy. Exercise more. It's not wrong. Eat lower salt intake. I will talk about salt. That one, there is more nuance. Cut down saturated fat and cholesterol. Cut down red meat. It's been lie. Then I will stop here because of our time. Atomic bomb of nutrition science: red meat. You eat red meat. You don't eat red meat. Maybe before you come next time, you eat red meat freely. But I'll show you the kind of red meat you eat and the type you should not eat. Thank you very much.